Katja Jansen, Roche Diagnostics. Entering the era of liquid biopsy, detecting EGFR mutations in the blood.
So, hello everybody. I'm happy to tell you today something about we try to enter the area of liquid-based or plasma-based cancer diagnostics. So, patients suffering non-small cell lung cancer can benefit from innovative therapeutic approaches like tyrosine kinase inhibitors, for instance, Tarceva. However, this is only true for those patients having an activated EGFR mutation. When those patients receive a tyrosine kinase inhibitor, the progression-free survival is nearly doubled in comparison to those patients treated with a conventional chemotherapy. Therefore, it's pretty important to identify all patients having an activated EGFR mutation. Normally, the detection of EGFR mutation is done by PCR or NGS from tissue samples. However, in approximately 20% of the cases, there is no tissue eligible or the quality of the tissue is too bad for molecular testing. Since approximately 1 year, there's a new technology called liquid biopsy available, which allows the detection of EGFR mutation in the blood, and therefore is a new chance for patients to be identified for targeted therapies. Liquid biopsy is based on the fact that tumors spill out DNA to the bloodstream, and this DNA can then serve as a template for a PCR reaction. With the help of the PCR, we are now able to detect the EGFR mutation from the blood and therefore conclude to the mutation status of the primary tumor. And this in turn is a new chance for patients which in the past wouldn't have access to targeted therapies. Of course, tissue-based testing is still the gold standard in cancer diagnosis. But as you can see from these publications, there's a pretty good concordance between plasma and tissue, and therefore plasma-based testing or liquid biopsy is a real alternative for patients where no tissue sample is eligible. In summary, what I want to show you today is that liquid biopsy or plasma-based testing is a new chance for patients suffering lung cancer to be diagnosed via a blood sample. There's a pretty good correlation between plasma and tissue, and therefore this could be a really good alternative for those patients. We also could prove the clinical benefit as patients which were diagnosed from a blood sample really respond to EGFR-targeted drugs. Monitoring is a potential future application, but the clinical rationale for that is still to be investigated. Thank you very much.